This video will demonstrate the proper use of the central line dressing change kit, each type of dressing, and the indications for each of the dressings. There are 4 dressing change kits, which are individualized for each type of line. The kits include a dialysis dressing change kit, long-term and short-term port access kits, and a vascular access kit. There's also a double lumen kit. Think of this like an accessory kit. It contains 2 sterile flushes and 2 sterile hubs or claves that can be used with a catheter with more than 2 lumens. Let's say you are changing the dressing of a triple lumen PICC line. You would need to grab the blue vascular access kit and the pink double lumen kit. You also need the dressing of choice. Once the kit is open, you would drop the contents of the double lumen kit and the dressing onto your sterile field. With each of the dressing change kits, there is a reminder in each pack of any additional items that will be needed to complete the dressing change. For example, with the vascular access kit, you will need to select a dressing that best fits the needs of your patient. But the dialysis dressing change kit contains the dressing and not the dialysis catheter ports or hubs. Remember, the vascular access kit contains enough supplies for a single or double lumen catheter. Anything with more than 2 lumens will require an additional double lumen accessory kit. The 3 dressings we will be using are the small SorbaView Shield, the medium SorbaView Shield, and the contour SorbaView Shield. The small SorbaView Shield is primarily used for peripheral IV catheters and radial arterial catheters. There are 2 parts to this dressing. Think of it like shirt and pants. This design helps to maintain the stability of the dressing. The medium shield is primarily used for PICC lines and midline catheters, but it can be used for any central line. This dressing also has 2 parts for added stability. Take note of the small window in the dressing. This must be lined up with the wings of the catheter. The wings should not be past the flat part of the window that's toward the end of the dressing. The SorbaView Shield contour dressing works well with catheters with multiple lumens, such as dialysis ports, introducers, and sheaths. There are perforations in the dressing to make it customizable for whichever type of catheter is being dressed. This dressing also has 2 parts. Take note of the differences in the smaller part of the dressing. It is perforated to be able to remove the inner square. This accommodates the multiple lumens of the catheter. The wing guard is to be used with PICC lines. Before applying to the catheter, stretch the wings of the wing guard to make application easier. The small half-moon area of the wing guard will line up with the biopatch once that is in place. Start by sliding the wing guard underneath the catheter. Slip one of the wings of the catheter into the side of the wing guard. Then, stretch the other side of the wing guard so that both sides of the catheter are contained within the guard. Then remove the backing of the guard and adhere to the patient's skin. Start by gathering all supplies, clearing and sanitizing the bedside table, and verifying the patient identity per policy. Perform hand hygiene, open the package, and start with the white removal portion of the kit. Follow the step-by-step instructions located within the kit. Apply the mask to the patient, yourself, and to anyone else in the room. Open the kit to the drape. Using the folded corner, carefully open the drape, touching only the corners. Place underneath the area that's being dressed. Using the included hand sanitizer, sanitize hands by scrubbing for 20 seconds. Allow it to dry completely, and then don the included gloves. Begin to remove the old dressing using the provided Detach-All product. Use the Detach-All only underneath the dressing between the adhesive and the skin. Putting it on top of the dressing will cause the dressing to separate and it will be very difficult to remove. Tear the dressing down the middle and remove it by pulling it low, slow, and toward the insertion site to avoid dislodging the catheter. Remove the biopatch if not removed with the dressing. If applicable, remove the wing guard using the included alcohol swab between the skin and the adhesive. Examine the exit site for external length using the provided tape measure. Visualize the site for any signs and symptoms of infection. Remove gloves and dispose of all removable items, but leave masks on. Now you will transition to the sterile field and dressing application. Follow the step-by-step instructions located on the kit from left to right. Carefully open the sterile drape by touching the corners only. Drop any sterile items onto the kit, such as the chosen dressing or additional flushes and hubs. Using the included hand sanitizer, sanitize hands for at least 20 seconds and allow to dry completely. Before starting, ensure that the site is clean, dry, and free of hair. Use clippers to prep the site if necessary. Activate the included chlorhexidine scrub and scrub the entire area for 30 seconds. Use a gentle back and forth motion to scrub. Use the included sterile gauze to pick up the lumens and scrub beneath. Allow the site to completely air dry. This will take at least 30 seconds or longer. If the chlorhexidine is not completely dry, the dressing will not adhere properly. The skin could potentially burn and blister. Next, apply the wing guard. Activate the wing guard by stretching the wings firmly. With the half moon facing where the biopatch will be applied, insert both wings snugly into the wing guard. Remove the protective backing and apply to the skin. Apply the biopatch so that it completely encompasses the catheter and both ends meet. Align the slit of the biopatch with the catheter to aid in removal of the dressing later. Use a very small amount of the included Mastisol around the edges of where the dressing will be applied. Do not apply any Mastisol near the insertion site or the center of the dressing. Allow this adhesive to dry completely. Next, apply the medium shield dressing. Align the wings of the catheter with the small window in the dressing, while ensuring that the insertion site is completely covered. Without stretching the dressing, remove the backing and secure it to the skin. Apply the dressing beneath the lumens and ensure that the dressing edges both overlap. Make sure that the dressing is completely adhered. Apply the second portion of the dressing beneath the lumens. Prepare the included hubs or cleaves by priming with sterile saline syringes. Use sterile gauze to pick up the catheter and to remove the old hubs. Ensure that the catheter is clamped before removing the hub, if applicable. Remove the hub, scrub the lumen with alcohol for 15 seconds, and allow it to air dry completely. Then connect the new, sterile hub and flush the line using a pulsatile flush. Repeat these steps for each lumen of the catheter. When finished, apply alcohol-impregnated caps to each hub. Date, time, and initial the dressing with the included tape. Be sure to also document all dressing change information, including the hub change and the external length of the catheter.